Hey, it's Dr. Watt from Pinecrest Chiropractic. Let's talk about our two favorite ways to do soft tissue on the TMJ. So there are 4 muscles of mastication when we chew, and those muscles are responsible for moving our jaw. 2 of the ones that we're going to work on today are your masseter, which runs right out here on the side of your jaw, and your temporalis, which starts right up in here, kind of on the side of your head, and runs down into the jaw. So the first technique that we're going to use to try and break down the tension and scar tissue in these muscles is called pin and stretch. And it's exactly that. We're going to pin that muscle down and then we're going to stretch it. You can take the same principle and apply it to any muscle in the body as long as you know the mechanics of it. So the first one is going to be the masseter that runs right through here. So we'll palpate through and we'll find the points that are pretty tight, tender, might have a little bit of a nodule there, and we'll pin that down. And go ahead and open your mouth for me. Yep. And as she opens it, it stretches that joint out and stretches that muscle. So that specific point right underneath my finger is now being stretched. And so we'll go through a couple passes of that until we start to feel that tissue change and the tension decreases. And we'll do this on both sides. We'll go through the right side up to the temple and work on the temporalis now. And go ahead and open. And you'll feel that pull all the way from right where my finger is all the way down into where that inserts. And once again, we'll go through a couple passes there as well. The other technique that we'll use to do some soft tissue work in those areas is dry needling. And so we'll use these teeny tiny little needles, the same needles that we use for dry needling in other areas. These ones are pretty short because there's not a lot of tissue that we're trying to go in through. And so the patient's head is turned up a little bit. We'll palpate through those same muscles, find the points that we need to needle, and insert that needle, only using the tip there. And so that needle will then sit in that point. We'll do a couple, I'll do 2 for this example, 1 down in the masseter, 1 up here in the temporalis. Maybe a slight pinch sensation, feels like there's some pressure underneath where that muscle is. And so we'll put a couple of needles in both of those areas, and we'll let those sit for just a few minutes. Those will usually sit 5 to 15 minutes depending on the patient and depending on how long it takes to change the tissue there. Once we're finished, we'll just pull those needles out and dispose of them properly. But both of these are really cool techniques to try and get that tension in those muscles to release down again, restoring proper motion through that TMJ, decreasing the symptoms that you're experiencing. If you want to chat more about these, come on in, let's chat about it.